We've seen a tremendous surge of patients with COVID-19 over the past 6 to 8 weeks. Over the past 6 weeks, every week, we've seen an increase in patients infected. Positivity rate's gone up every week. The number of patients coming into the hospital that are requiring acute care has gone up, and the number of patients dying has gone up as well. We've seen this happen very quickly, faster than we've seen in any of the surges over the past year and a half. So the Delta variant is much worse than the previous variants or the previous strains we've seen circulating. For every person that is infected, they can infect up to 9 or 10 people. The viral loads are much higher, meaning that the virus spreads much quicker, more effectively to the community. So those that are not vaccinated right now are at high risk for infection, much more so than any previous surge we've seen with the other strains. This strain has clearly impacted kids more so than the previous strains we've seen. Our healthcare system on a typical month in June was seeing 20 kids. We're now seeing over 240 kids every month with COVID-19. Kids are getting infected, they're symptomatic. It's important that parents understand kids can bring it home, they can infect the family, and it's extremely important if your kid is 12 and older to get vaccinated. Get your child vaccinated if they meet the age requirement. I've vaccinated all 3 of my children, they're over 12, and none of them had any significant side effects other than some body aches the next day. We've been given vaccines for almost 100 years, the polio vaccine, tetanus vaccine. There's all types of vaccines out there that people have been receiving safely for many, many years. Everybody at some point will require a booster shot. The natural course of immunity, whether it's from an infection or whether it's from a vaccine, is your immune response will wane over time. Depending on your age and your comorbidities, you're going to need a booster vaccine at some point. This virus has continued to circulate because people are not vaccinated, and the quicker people get vaccinated, the less boosters we will need, the less issues we will have, and the pandemic will eventually wane. People that are fully vaccinated can harbor virus, and it is in the best interest of everybody to wear a mask out of safety. We don't know who's vaccinated and who is not, so everybody should be wearing a mask now, particularly indoors, in crowded places, in public places. The healthcare providers providing care to patients in the emergency departments right now are exhausted mentally, physically, emotionally. It's been a long year and a half, and it's impacted everybody. We're here to take care of people. We will always take care of people that show up on our front door. Everybody has somebody that needs the hospital at some point, and our ability to take care of those patients effectively will be directly related to the ability to vaccinate everybody in our community. So right now, it's not about you, it's about the people around you and your family and everybody else. It's no longer a decision we have an option for. Everybody has to get vaccinated if we want this pandemic to end.